Welcome everyone to today's lecture on optic disc drusen. In this session, we will explore the various aspects of optic disc drusen, including its introduction, pathophysiology, clinical presentation, diagnostic evaluation, differential diagnosis, associated conditions, visual field defects, complications, management, imaging modalities, genetic and molecular mechanisms, neurodegenerative processes, familial optic disc drusen, surgical interventions, experimental therapies, and future directions in research. So let's dive in and begin our journey into the fascinating world of optic disc drusen. Optic disc drusen are calcified deposits in the optic nerve head. The exact cause is unclear, but it is thought to be related to impaired axonal transport. Drusen can be congenital or acquired and may be associated with other systemic conditions. Optic disc drusen may be asymptomatic or present with visual disturbances. During examination, drusen appear as elevated, yellowish-white lesions. Further evaluation using imaging and visual field testing confirms the diagnosis, while investigating underlying conditions. When evaluating a patient with optic disc drusen, it's important to consider other conditions that resemble its appearance. Optic nerve head drusen are similar but located differently, while papilledema presents with disc swelling due to increased intracranial pressure. Optic disc drusen also have associations with certain systemic disorders. Visual field defects in patients with optic disc drusen can occur due to mechanical compression of nerve fibers or impaired blood flow. Different patterns of defects can be observed and assessed using techniques like Humphrey visual field analysis. Complications of optic disc drusen include papilledema and ischemic optic neuropathy. Papilledema is optic disc swelling from increased intracranial pressure, while ischemic optic neuropathy is reduced blood flow to the optic nerve, leading to potential visual loss. Differentiating between these conditions is crucial for appropriate management and prognosis. Additionally, patients with optic disc drusen should be educated about the condition and its potential implications. They should be advised to follow a healthy lifestyle and monitor any changes in their vision or symptoms. Overall, the management of optic disc drusen requires a multidisciplinary approach involving ophthalmologists, neurologists, and other specialists to ensure optimal patient care. Regular monitoring and prompt intervention when complications arise are key in maintaining visual function and quality of life for individuals with this condition. Imaging techniques are crucial for diagnosing and monitoring optic disc drusen. Optical coherence tomography, OCT, provides high-resolution images of the retinal layers. B-scan ultrasonography helps differentiate drusen from other conditions, and fundus autofluorescence assesses drusen activity. Using these modalities together improves accuracy and monitoring. In the study of optic disc drusen, the genetic and molecular mechanisms responsible for their formation are not completely understood. However, research has identified potential genetic associations, such as mutations in the ABCC6 and SLC24A1 genes. ABCC6 is responsible for cellular ATP release, and its mutations are linked to pseudoxanthoma elasticum, which often overlaps with optic disc drusen. Additionally, mutations in SLC24A1 have been observed more frequently in patients with bilateral optic disc drusen. Exploring these genetic and molecular pathways could pave the way for targeted therapeutic interventions in the future. Optic disc drusen has been recognized as a primarily neurodegenerative disorder rather than a simple deposition of calcium and hyaline material. Researchers have found evidence of impaired axonal transport, mitochondrial dysfunction, and inflammation in optic disc drusen. These neurodegenerative processes contribute to the progressive degeneration of retinal ganglion cells and the subsequent visual field defects. Further research is needed to elucidate the precise mechanisms involved and to develop therapeutic strategies targeting these processes. Familial optic disc drusen refers to cases where multiple family members are affected by the condition. It suggests a genetic component in the development of optic disc drusen. Different inheritance patterns have been observed, including autosomal dominant, autosomal recessive, and X-linked inheritance. Genetic counseling is essential to provide information about the risk of transmission and potential implications for affected individuals and their family members. Surgical interventions may be required to manage complications associated with optic disc drusen, such as papilledema and ischemic optic neuropathy. Optic nerve sheath fenestration is a surgical procedure that creates a communication between the subarachnoid space and the orbital cavity. This helps in diverting the cerebrospinal fluid and reducing intracranial pressure. Other surgical options, such as optic nerve decompression, may also be considered in specific cases. Surgical interventions are performed with caution, and careful assessment of the potential risks and benefits is necessary for each individual case. With a better understanding of the pathophysiology and genetic basis of optic disc drusen, researchers are exploring experimental therapies to manage and potentially reverse the disease process. These experimental therapies include targeted drug delivery, gene therapy, and neuroprotective agents. While still in the early stages, these approaches show promise in halting or slowing the progression of optic disc drusen. In addition, future research aims to identify novel therapeutic targets and develop more effective treatment options for optic disc drusen. In conclusion, optic disc drusen is a complex condition characterized by calcified deposits in the optic nerve head. Diagnosis involves visual field testing and imaging. Management focuses on monitoring and addressing complications. Exciting research may lead to improved treatments. Thank you for watching.